Good morning, 531 class. Dr. Hastings here. Hope everybody's well and that you've had a restful weekend. I can say for myself, it has not been a restful past week between going to a professional conference and my car officially having died and now having to get a new one, and a lot of midterm related busyness going on. It's been a little hectic, but that said, I certainly look forward to being in class this week, and especially next week when we start the seminar progression, to which I have some other thoughts about the timeline in terms of maybe extending it. Right now we have it just for several people each week, and I'm wondering if we even want to overlap that and even extend the timing. But that's something I'll talk about later on. All right, relative to the topic for this week, multiculturalism and diversity, a very important topic and clearly something that we have to pay attention to relative to the changing demographic of our student cohorts and our society. Certainly those that we engage as patients when we're acting in our clinician role are a reflection about how we need to become much more culturally sensitive and competent to being able to address a range of diversity issues. So, relative to this topic, I think it's just important to note a few different things that we see within nursing ranks as far as our students, as the number of males are increasing, which is a very positive thing from my standpoint. I've definitely seen a percentage increase versus when I went back to school almost 25 years ago. We see, of course, this age demographic with mostly, as we'll refer to as Generation Xers, that have been within what we'll refer to as adult cohort or non-traditional cohorts. So individuals who oftentimes have worked in some other kind of vocation or career and now want to address another option and consider healthcare as something that would be much more satisfying or stable type of path, and one that is professionally driven and career oriented. But obviously a lot of variables associated with what they have to juggle. And then the newer group, Generation Y crowd, the connected generation, hence an online course should support them well. But to be able to have ourselves as nurse educators be able to stay in step with or keep up with this group. They're the truly connected generation, and they're great multitaskers. So it is a challenge. Note that about 30% of nursing students are considered minorities, though, and I think we need to consider that on a couple different planes. Certainly the ethnic side of things, but social culture, there's a lot of different variables along religious lines, along socioeconomic lines. So I think just having a sensitivity for that. Also note that incompatible with that theme is that most faculty are Caucasian, and the notion about being able to be sensitive and to be acting inclusively, I think that's hard. I think nursing education is challenged to that. So since the culture of academia, it tends to be upper middle class Caucasians, trying to find that middle, that compatibility, that sensitivity for a diverse population. And I can speak to that. I really did not deal with a particularly diverse population when I taught at Misericordia University or at Bloomsburg University. So being at Cedar Crest, this is probably the first time I find myself being a bit challenged to go in that direction. All right, so the barriers, there's a number of them, and I think AAC and NLN articulate these fairly well, but certainly difficulties with language and communication on the student side could be an issue. We need to be sensitive to that. Workload conflicts, family obligations, and other community-based things that are culturally oriented are important to consider and address. So we need to be sensitive and open and to support inclusion. Expectations for behavior then too, the whole notion about assertiveness relative to certain expectations and behaviors in a high-pressure nursing program are substantive. Financial issues, limitations in community supports, because ultimately many of those who would be deemed minorities are dealing with stigma and barriers in terms of their moving forward in their residence. So there's a lot of challenges that are even rooted in or fundamental to population health concerns just for our nursing students as well. They're living it, the lived experience. So trying to be sensitive to that's important. So we have to understand as educators learning preferences, and non-traditional students have to be considered in the context of educators being flexible, to the types of offerings, the types of platforms that are available, i.e., online type of platforms, asynchronous online platforms, things like that. So consider a variety of modes to deliver content to really match that diversity. Note how distance learning supports and really allows, relative to online types of programs or online communities, better access for this busy cohort. It's hard for them to be in class to make it. And hence the same relative to us in our graduate cohort groups. Be specific relative to adult learning. So andragogy is really the alternate form of pedagogy, being sensitive to adult learning needs, typically in the context of active learning styles, being able to look at that interaction and relationship-oriented type of dynamic, which is arguably challenging online. Hence why I do these video clips, so that we're connected a bit better, and that there is a sense that we have a relationship. And also consider, within the context of adult learning or andragogy, the idea that adults prefer reflection and to analyze experiences, making connections using concept maps, which is something I want to use more in a class like this in the future too. It's easier to conceptualize it relative to healthcare themes and pathologies and things like that, relative to assessment and intervention and evaluation pieces. We think about with nursing process, but think about that for any element of education. And then looking at fostering resilience. There's a lot of stressors in the lives of many of our diverse student groups or population or subpopulations, so to speak. We don't want to necessarily categorize or label those individuals, and we can't necessarily meet the needs of every given subpopulation, but to be able to be sensitive and appreciate that, understand the nature of those stressors and the community based issues that some in our nursing student cohorts may be challenged with. Just to be in school, just to be able to maintain standing is tough. So we want to provide context to students, to help understand. Then we understand where they're coming from, but by the same token, the lived experience of a student in a rigorous health provider type of program like nursing. How do we appreciate better the lived experience context of our patients while respecting their lived experience and the challenges of being students? I think it's important that that context is embraced so that we understand what their needs are better. So Knowles and Hodges, in those two references, look at some key points that have been found through the literature, through research over the years, but by the same token, we need to try to identify with our students better, learn who they are, develop relationships early on with the diverse student cohorts. So consider theories, again, about how people learn, in effect, then too. So the Kolb learning or inventory style learning in particular. Look at then again those four different domains within that: accommodative, assimilative, divergent, convergent, because there's going to be a mix. People might not fit into a discrete category, but they're going to overlap relative to these areas, these domains. And then consider critical thinking inventories to better get a sense on your side of what their capabilities are. So Watson-Glaser critical thinking skills tests or the California critical thinking skills test. These are things that are easily accessed and something that might help give you a pulse, so we can better understand the type of student that we are engaging. The Institute of Medicine recommends that the country double the number of nurses with doctorates. Yes, that is an important challenge, but we need to be also sensitive to increase the number of diverse educators. So more doc-prepared nurses certainly promote nursing-led science and discovery and contribute to better care for patients, but increasing the diversity in these programs will increase diversity in the workforce as well, to which we can meet our patient needs far better. Look at this HRSA survey. I think it's really insightful to see how the nursing workforce is growing. Certainly a lot of challenges there. So educators need to develop cultural understanding, understand there are multiple truths relative to the students we serve and to the community to which we are addressing our community of interest with our students. Have a greater sense of sensitivity to respect cultural differences within our students, just as we try to within our patient populations that we're serving, and then promote skills that are effective ways of communicating, engaging, and including these students. So a culture of inclusion, I think, is really important, hence this link from AAC and then to, and the box in Billington Hall said 268, box 16.1, I thought was really well done to sort of address that. So think about, again, this whole notion about, within the context of culture and learning, different planes of consideration, ethnicity, gender, and individual abilities. And as a social justice person, I tend to try to think about these better. I expand upon that. I think about the culture of individuals in lower socioeconomic stratums. I work primarily in mental health, so I think of the culture of people with mental illness, things like that. But let's just say that certainly bias stands out amidst that, and on those planes, but certainly with respect to gender. So in higher ed, it's more typical for faculty to pay attention to Caucasian males. Why is that? So despite the fact that our female cohorts are much larger in nursing, we need to avoid that latter, and the bigger theme might be to ensure proper boundaries of interacting with students based on gender. That would be more important. I know I'm very sensitive to that as being, let's just say, a minority amongst my nursing educator peers. So consider then internal and subtle tendency to show bias. It's not easily negotiated or understood by any of us. And remember that English is not the only language. We need to understand and appreciate how ESL may be a consideration relative to our being able to communicate effectively and express the context of even our teaching themes. So academic programs, we have to think about, effectively curriculum retention at one level, but certainly within curriculum, our big theme, integrate diversity across the curriculum. I think that's an important consideration. It starts with the syllabus, be very transparent and clear about what we're expressing, what we're stating. So course materials should pay very close attention to bias and to be try to eliminate that or minimize as much as possible and explain what that bias might be. Be upfront and transparent. Learning activity, the same thing. Foster interaction and collaboration so that we're all together. Inclusion means, despite our diversity, we're all embracing that those differences and coming together to be better for what we can as a class achieve relative to respecting and valuing our differences. And then online, watch for internet sources of communication bias, because that is even more insidious, albeit sometimes even that much more subtle. Okay, I hope you enjoy this content. I look forward to a very positive and interactive discussion this week, and I will see you online.